In the heart of Africa, Malawi is making remarkable strides in strengthening its health systems. Through strategic partnerships and targeted investment in laboratory infrastructure, the Ministry of Health is laying a solid foundation for disease detection, response, and prevention. A key partner in this effort is the African Society for Laboratory Medicine, ASLM. In collaboration with the Public Health Institute of Malawi, FIM, ASLM has supported the development of laboratory infrastructure, enhanced technical capacity, and improved network coordination across the country.
The genomics lab is relatively new among these labs, but we thank all the support and the partners that work with us to make sure that we continue to build the capacity. So as genomics lab, lately, we just managed to diagnose the mpox and even go down to classify this as the class 1B mpox. So that in itself is an achievement. And of course, we also do some analysis on the COVID-19, and we just also did on the cholera, the Vibrio cholera. So these are some of the capacities that are there and continue to grow in terms of the genomics lab.
Combating antimicrobial resistance, AMR, is one of the critical areas ASLM has supported. Working with FIM, ASLM has strengthened personal training and surveillance capabilities to detect and respond to resistance patterns.
We're also getting quite substantial support from our Preparedness Fund to such an extent that the equipment that you see here at this laboratory, and also if you move into about 8 or 10 laboratories in the country, you find similar equipment, high-class equipment that has been supported by the Preparedness Fund, as well as if you move around here and as well in the districts, you find that we have capacitated people in terms of training. And through the Preparedness Fund, we're also working very closely with them on antimicrobial resistance. You know, this is a very big issue in all over the countries.
In partnership with Africa's CDC, ASLM played a central role in establishing Malawi's phase pathogen genomics laboratory, a transformative milestone for the country. This facility has significantly enhanced Malawi's ability to detect diseases and respond swiftly to outbreaks. Previously, samples had to be sent abroad, causing delays in identifying and managing deadly infections.
The National Genomics Reference Laboratory, it came into being around 2023. This was so when we had COVID. So it's like all the countries were struggling to get the services for COVID-19. Because with COVID-19, we wanted to monitor the different strains, because there was a lot of mutations, so we wanted to see which strain is circulating. And before that, as a country, we used to send samples to elsewhere outside the country for sequencing. And during COVID-19, it's like everyone else was busy with their own problems. They didn't have time to also support the other countries. So during that time, we found that most of our samples would take a lot of time for us to get the results. And that also really drilled our response to the outbreak. And remember also, During that time, there was this the travel restrictions. Even the airplanes were not flying. So that also had a major challenge on how we are going to transport those samples to the outside where it will be sequenced. So with those challenges, the leadership here, with the support from Africa CDC, the African Pathogen Genomics Initiative, supported this lab with equipments, and that now will be able to start sequencing in country. And that was the first time we had the sequences with that support.
Another area of notable impact is bioinformatics and genomics training. ASLM's capacity building initiatives have equipped Malawian scientists with the skills needed to analyze complex genomic data and support evidence-based public health responses.
ASLM is a true partner of the Ministry of Health in strengthening of laboratory systems. Like you have rightly said, we have had a few trainings in leadership, and these trainings really come in at a very timely time, whereby as a ministry we are trying to strengthen laboratory systems. You can agree with me that labs, they have really played a very big role in terms of like the time of COVID and all these outbreaks that we are seeing recently. We are seeing mpox. So we need to have a vibrant laboratory system, laboratory network that we can be able to handle such. So the leadership trainings really assisted. One of the areas that have been assisted in is lab mapping. So we have been able to map our labs to know what areas have got access to diagnostic services and which areas still need to have access to laboratory services.
Through programs like the ASLM internship and the Qualifying the Workforce for AMR Surveillance QUAS initiative, a new generation of laboratory professionals is emerging to take on leadership roles in Malawi's health sector.
The microbiology lab, my role was centered on quality management system, whereby I was involved in the CERTCAS accreditation success. And I've also been able to review EQA Africa external quality assessments, which has been very helpful in my journey at ASLM because I was also stationed to rotate in QMS department online. That's like an online department with ASLM. So it was very helpful to gain the hands-on experience here with the host organization, while also learning and gaining experience with the ISO via the online platform.
I'm one of the beneficiaries for QUAS project, which was being supported by ASLM. QUAS project is one of the most beneficial initiatives which I've benefited in this lab. It has helped me to improve my skills in the lab for identification, for AST, even to produce the quality data for AMR specifically. This has helped us to improve the data generation for AMR, which we are able to report to GRAS as well. To be able to showcase on the global scale how this training has improved our data quality within the AMR space.
Investments in bioinformatics training have proven vital in building a skilled workforce. In June 2025, ASLM conducted a 2-week bioinformatics workshop in Malawi, training 20 laboratory professionals on integrating technology to improve workflows and diagnostic precision.
This training also gives us a platform where we can come together, and that gives us like a networking platform. So we can also be sharing data, and that will help us understand the pathogens more.
it was very interesting to note that we can have a proactive approach to emerging threats by monitoring what's going on in the wastewater in Malawi.
Laboratory accreditation ensures that laboratories meet international standards, providing reliable and accurate test results that inform public health decisions, and Malawi has made strides to have international accreditation for its central laboratories. ASLM has also supported efforts towards laboratory accreditation, ensuring that Malawi's laboratories meet international standards and provide reliable, accurate results to guide health decisions.
In detection of cases under One Health, you need accurate and reliable results. So to ensure that the labs produce accurate and reliable results, you need to continuously monitor their proficiency, if they are able to detect particular organisms accurately. And this also through the very same ASLM, it has been capacitating us to be able to produce proficiency testing panels locally. ASLM has also supported us through an audit to ascertain us if we are ready to be accredited, and it gives us recommendations which we have addressed. We are having virtual meetings on implementation of ISO 17043, which we attend, and then they reinforce and enhance our knowledge in implementation of this particular standard.
The other area that we will be supporting in this project is working with you to establish a national certification program for your laboratories. The lab where genomic sequencing is being established, we also want it to be accredited to the international standards through establishment of quality management systems. So over and above that, we also want to support the country in having a national certification program where you are able to monitor your labs in terms of their quality management systems as they build towards international ISO accreditation. So this will be very important through other programs that we've done before, like the WHO SLIPTA program, where some of the labs where you're coming from also went through that program. We also want to build onto that and say, can Malawi now have their own national program where they're able to track laboratories and ensure that they continue towards ISO accreditation.
Strong partnerships are the backbone of Malawi's progress. By collaborating with key players, the country continues to leverage expertise, resources, and innovation to build a more resilient health system. One of these vital partners is Center for International Health Education and Biosecurity, CHEB.
So we're doing this work through a collaboration with ASLM, the University of Maryland, Baltimore, and also Community of Sant'Egidio. We did this collaboration to make sure that we are able to leverage on each other's strengths to deliver more on the work that we're doing. We are supporting 14 molecular labs across the country, and also the national reference laboratories. Core to this work is capacity building, and this is in various areas across laboratory services, from service delivery, testing methods, and so on, and other leadership and other areas. We are doing this with in-service training, but also we are also working with various training institutions to strengthen their curricula, so that lab experts who are coming out of these training institutions are fit for the current needs that the laboratories need.
ASLM's footprint in Malawi is a testament to the power of collaboration. Together with the Ministry of Health, FIM, CHEB, and other partners, we are shaping a healthier, more secure future for Malawi and a healthier Africa for all.